Good morning. My name is Leah George, and I will be talking about how COVID-19 negatively affects society with PTSD. Some background information on COVID-19. The first COVID-19 case was reported in late December 2019. North America's first COVID-19 case was reported January 13, 2020. The U.S. hits 100,000 deaths due to COVID-19 May 27, 2020, and deaths passed 1 million worldwide due to COVID-19 September 28, 2020, almost a year after the first reported case. And 77.5% of people have been infected at least once in their lives with the coronavirus. PTSD, also known as post-traumatic stress disorder. It's a common, potentially debilitating mental health condition as a result of fear and stress. PTSD is a result of people who have witnessed or experienced a traumatic event. It gives intense feelings of fear, horror, or helplessness. The responses include cognitive, emotional, and psychological changes with the brain. As COVID-19 spreads, it's necessary to note the PTSD pandemic effect, such as fear of infection, exposure factors, social isolation, etc. For my stimulus, I chose Confrontation on the Bridge by Jacob Lawrence and Predator-Induced Fear Causes PTSD. I connected these two things to my topic using the fight or flight response, which is an automatic reaction to an event that is perceived as stressful or frightening. Threat triggers a stress response that prepares the body to fight or flee. I can compare this back to Confrontation on the Bridge because African Americans are stopped by a violent dog that stands as a symbol as the police. They have a fight or flight choice. I can also compare this back to Predator-Induced Fear Causes PTSD because the prey have a fight or flight choice to survive from their predator. Comparing this back to my topic about the COVID-19 pandemic, the coronavirus is the predator while we are the prey. We have a fight or flight choice. We could fight the COVID-19 virus and continue living our lives, or let the COVID-19 virus affect us, leaving us with PTSD. Some key vocabulary to know. As I explained earlier, PTSD stands for post-traumatic stress disorder, which is having intense feelings of fear, horror, or helplessness from past events. PTG stands for post-traumatic growth, which is having a positive change as a result of trauma, struggle, or a major life crisis. And GAD, also known as the generalized anxiety disorder, which is a result of being anxious, nervous, worried, distracted, restless, etc. COVID-19 negatively affects society economically. The GDP and industry recession suffered. Gross domestic product fell to 9% below its level at the start of the recession. There was a decline in retail sales and contradicting measures of income. The agriculture industry also suffered. The supply and demand for food led to shortages in the U.S. This chart here shows how in March 2020, the employment ratio and personal spending during the COVID-19 pandemic dropped. The U.S. economy lost 23 million jobs at the start of the pandemic, leading to a recession in early 2020. Revenue from indoor dining, air travel, and participation from large indoor gatherings fell by more than 50% in the first 30 months of the COVID-19 pandemic. Economically, the COVID-19 pandemic sent a shock through the economy, resulting in the largest global economic crisis in over a century. Who this affected? Healthcare workers, specifically nurses. Nurses are at risk from developing PTSD from direct contact, lack of knowledge, and risk of infection. Stressful work situations like witnessing death, trauma, and working in overcrowded settings can also result in PTSD. 35.5% for frontline healthcare workers in direct contact and 27.3% for those providing indirect care had PTSD. PTSD diminishes concentration, resulting in medication errors and disrupting work performance, which could affect the patient's safety. These patients affected experience feelings of loneliness from isolation during this time. Children were also majorly affected from the COVID-19 pandemic. A big issue is education. The lockdown of schools prevented students from their usual lifestyle and essential education. The lockdown resulted in an additional set of social, emotional, and academic challenges for students. Kids fell behind academically and had a hard time adjusting back to the school environment. Isolation and social interactions was also hard for children. This resulted in loneliness and social anxiety, which could make them vulnerable to psychological stress. They missed out on social activities such as sports teams, school events, and playing with other children. Children were also deprived of social connections and interactions with their peers. This here shows how children were affected with their health from the COVID-19 virus. There was things such as the chronic cough, wheezing, bronchitis, asthma, etc. Adults were also majorly affected during the COVID-19 pandemic. They experienced PTSD with flashbacks, difficulty sleeping, and avoiding anything about their past. There were high reports of anxiety and depression in adults during this time. Adults who experienced household job loss were more likely to show symptoms of anxiety. COVID-19 resulted in more substance use and more death rates due to substances. In 2021, there was over 100,000 deaths in the U.S. due to drugs, the highest on record. Many adults with children have more anxiety due to stress to provide for their children. And some adults acquire GAD, known as the Generalized Anxiety Disorder. Solutions. Most importantly, vaccines. In December 2020, the Moderna COVID-19 vaccine was found to be 93% effective in preventing COVID-19. There are 2 types of COVID-19 vaccines available and many other boosters. Self-protection and health checks is also very important, such as just taking care of yourself and checking your health to make sure you're healthy. PTG, also known as post-traumatic growth, which is a positive change experienced as a result of struggle with trauma or a major life crisis. This gives improved relationships with people, increased spiritual and personal strength, and a new appreciation of life. To conclude my presentation, the coronavirus will continue to live on, if not in its original virus, then in different ways, versions, or mutations of itself. Beyond the COVID-19 virus, the mental health effects will also continue to live on. Overall, COVID-19 affected the society negatively and will have everlasting PTSD effects on the world. We're excited. Thank you.